My name's Ashley Sprout, and I'll be doing my presentation on the Lebanon Free Clinic. The Free Clinic is located in Lebanon, Pennsylvania. By the end of this presentation, I hope that you learn a lot about what the Free Clinic has to offer, who is able to go to the Free Clinic, and what you can do if you would like to donate supplies or give your time at the clinic. There's a variety of population that is served at the Lebanon Free Clinic. One of the requirements to become a patient at the clinic is you have to be a resident in Lebanon County. Unfortunately, they can't take any residents from other counties. Another population that's served quite frequently at the Lebanon Free Clinic is homeless patients. The clinic works very closely with the Mission, the Women's Shelter, and some other shelters in the area in Lebanon. I know right down the street there's the Mission. They work very closely together. Another type of population that the Lebanon Free Clinic serves is patients who have no health insurance. Unfortunately, if a patient has Medicare or Medicaid, they cannot accept them on their services. They have to strictly have no insurance at all. They are allowed to obtain insurance once they're there, but as soon as they get that insurance, then they aren't allowed to return to that clinic anymore. The Lebanon Free Clinic serves both males and females. They don't really serve any children there. It's mainly adults. Anyone over the age of 18 is allowed to have an appointment at the clinic. When I decided to choose the Lebanon Free Clinic for my service project, it really reminded me of a family care center with a little bit more services that are able to be offered. At the Lebanon Free Clinic, they are able to do sick visits if the patient comes down with a cold, or if the patient injures themselves. They are able to do minor suturing there. If it's something major, then they will refer them down the street to the Good Samaritan Hospital. The patients also are able to come in for routine checkups. This would be for diabetes, hypertension, if they're on blood thinners. They do schedule them usually with the same physicians if possible, but that's whether they'll be monthly, weekly, yearly, etc. We are able to draw labs on the patients who are there. We send all of our lab work over to the Good Samaritan Hospital, and then it's processed at no charge to the patients. One of the really interesting things about the clinic is medication refills. At the clinic, they have a whole room that's set up to do medications where they can supply them to the patients. They'll get them before they leave that evening or that day. There's a pharmacist that will work back there and get all the medications provided. The only type they don't have are narcotics. The clinic also is able to do EKGs. As far as diagnostic services, they'll give you a script, and then the clinic has a contract with Good Samaritan Hospital where the patients can have those diagnostic services done over at the hospital, no charge to the patient. The Lebanon Free Clinic also offers psychiatric services and counseling. There's a MD who specializes in psych. He will treat those patients, and there's a counselor that will sit with them, each of the patients, for an hour, talk about them, discuss any problems that they're having. She, however, will not dispense any medication to them. Being a registered nurse and volunteering at a free clinic, there's going to be a lot of issues that are encountered, and there's a lot of issues that I did encounter throughout my time volunteering at the clinic. To start out, social issues, just meeting with the patients each time and learning about them. You learn that they have a lack of knowledge, a lack of understanding of when they need to see a doctor, when they should be seeking treatment, and not to let stuff go. You also learn that a lot of them have had a lot of stuff going on in their life, whether they're abused, whether they have mental health issues, But a lot of these patients are afraid of physicians and the nursing staff as well. It takes a lot of time to gain that trust between the doctor and the patient and the nurse and the patient for them to truly open up and be compliant with their care. As far as political issues, government assistance and medication programs are two of the biggest things that I've seen the patients having to encounter. They're unable to qualify for Medicaid insurance or unable to afford regular insurance. The free clinic does offer medication programs for the patients, whereas if they are going to venture out into the community to receive care, or if one of the medications isn't covered in the clinic, they can sign them up for a program to receive the medications at a discounted price. Being a nurse working in the free clinic, I've also come across economic issues that the patients have endured, with them having no health insurance, being homeless, or not having an income. The last thing they want to do is spend the money they have on medications and tests when they need it for food. I've talked to a lot of the patients there, and the cost of medication is just outrageous. They aren't able to afford the medication that they truly need. The clinic again provides them with medication, but if it's something that's not carried in the clinic, then they do have to go to an outside pharmacy. The patients also talk about how they're not able to afford testing. That's another reason why a lot of them don't go to the doctors, because they are afraid the doctor's going to make them get a test that they can't afford. They're afraid they're going to get turned away because of not having the money. The free clinic turns nobody away because they don't have money. Again, the medications and diagnostic testing, is offered at no cost to the patient. Other issues I've encountered working at the free clinic are cultural issues. One of the biggest thing with the patients is communication barriers. The patients that come there are currently residents of Lebanon County, but may have been born in another country or speak different languages. We have a lot of patients that speak Spanish, and have expressed that they were afraid to go to a different doctor because they don't understand what the physician's saying. They do have interpreters at the Lebanon Free Clinic that is able to ensure all the patients truly understand what's going on. There were a couple patients that I came into contact with that did not believe in taking medications, where you can see not taking medications for chronic illness such as diabetes, hypertension, it could limit their care. So definitely a belief in medications is another barrier that I've encountered. Prior to choosing the Lebanon Free Clinic, I looked at many different facilities around. When I saw this one, I knew it's something I wanted to do. I've always enjoyed working with chronic illnesses, especially mental health. So I contacted Margaret Brandt, the director at the Lebanon Free Clinic. Her picture is on the left there. She brought me in. We sat down and met for about an hour, hour and a half. She told me what the clinic had to offer, how is it funded. She took me on a tour of the clinic. After she told me that I was accepted to be a volunteer there, I had to get my picture taken. We had to wear a badge just like at any other facility. She also gave me paperwork that I had to complete. Just like any medical job, I had to know how to use their equipment. She had me fill out and sign HIPAA forms, and then I also had to know how to use like the glucometer and knew their standards at the facility. She had me go through charts to make sure I knew the proper protocol, how they write their nurses' notes. The Lebanon Free Clinic, all of their charting is all on paper still. Nothing's via computer except for their appointment log. So she showed me back to the old school nursing, you could say, of how to do all your nursing notes in the chart, not in the computer. I also provided her with a copy of my service agreement. I had her sign that, write down what I would be doing at the clinic, and I showed her what my objectives were, what I was hoping to get out of this experience while volunteering at the Lebanon Free Clinic. If I had the opportunity to make any changes at the clinic that I was at, I would definitely volunteer more frequently. Due to my current schedule at my full-time job, I only was able to volunteer Thursday evenings, so I usually saw the same people every Thursday or every few Thursdays that I would work. I would like to work on Mondays where I was able to do new patient intakes and just see what some of the other days has to offer. I would also like to see different roles volunteer at the clinic. Right now, the physicians and the nurses are the main volunteers. It'd be nice to see some dietitians give some time there as well. I would also like to donate more supplies to the facility. I was able to donate some medical supplies, but just seeing how grateful they are and how much they use, I would definitely donate more supplies, especially medications, over-the-counter medications like Tylenol. And being a nurse and dealing with these chronic illnesses, I think it's very important to create new teaching tools for the patients. They're so grateful for everything they have. Anything that could help them learn about their illness, they'd be appreciative for. Prior to starting at the Lebanon Free Clinic, I developed 3 learning objectives that I hope to achieve while serving at the clinic. The next few slides will go into more detail about what each of those objectives were. Meeting objective 1 was, by the end of this project, I will identify the most common population that is served. The most common population served at Lebanon Free Clinic would be between males and females between the ages of 40 and 60 who have no health insurance and who are also unemployed. My second objective was, by the end of this project, I will identify the top 5 health issues that are seen in the clinic. They were definitely chronic pain issues, mental health issues, specifically bipolar and depression, diabetes, HIV and AIDS, and hypertension. My third objective was, by the end of the project, I will develop 3 education plans for chronic diseases. I was able to teach a patient regarding their diabetes, how to check their sugars and what to do if they're high or low. I was able to develop a log for a patient who had high blood pressure, so they were able to record it for the next times they came in. And I also discussed a healthy diet with them. And I also educated a patient who was newly started on Coumadin due to atrial fibrillation. So as I was able to develop an education plan for them regarding their medication and lab work. While spending time at the free clinic, it was amazing to see the impact the clinic had on these patients. Their health improved drastically. The more the patients came, it was amazing to see how they finally kept their scheduled appointments. In the beginning, there was a lot of them who would do a no-call, no-show. The clinic housed over 5,000 patients, and they had a wall that was filled with thank you letters from the patients who were being treated at the free clinic. This service learning project definitely impacted me both personally and professionally. I was able to provide community service to the patients who are in need and don't have health care like we do. I was able to pass on knowledge that I've learned in nursing school and learned as being a nurse. I was able to educate them on diseases that they deal with on a daily basis but really don't know anything about. While at the free clinic, I was able to help the pharmacists out, distribute medications. I've passed pills before, but I was never able to log into the database and truly be a pharmacist for a day. While at the free clinic, I was definitely a patient advocate. When they came in, it was all about them. This service learning project definitely made me a better nurse. It made me realize how having so little you can still be so grateful for. These patients, a lot of them didn't even have a home. You would have never known it. They came in with a smile on their face and were so grateful. Even if they walked out with a bottle of lotion, you made their day. This was my project on the Lebanon Free Clinic. On this slide, you'll see Margaret Brandt's phone number if you would like to contact her to volunteer or donate supplies. and there is a list of supplies that they would be happy to accept. Thank you.